Good morning, my name is Dr. Tyler Christensen. I'm a board-certified urologist here at the Ogden Clinic. I work with my partners Dr. Wayman and Stevenson. We specialize in no-scalpel vasectomy, and we perform hundreds of vasectomies every year. Today I'd like to take a moment and discuss with you what to expect for a vasectomy. I'd like to discuss preparation for a vasectomy, what occurs on the day of the procedure, and what to expect after. Everybody likes to joke. First of all, you need to stock up on the bag of ice and bag of peas in the freezer. On the day of the procedure, we want you to bring a pair of compression shorts into the office. As may be different for other procedures, we encourage you to eat a meal before the procedure. Patients will sometimes drive themselves to the clinic, or you can bring a driver to the procedure. When looking at the benefits of vasectomy, vasectomy is the most effective, most cost-effective, safest, and permanent form of surgical sterilization. When talking about how effective is vasectomy, the failure rate is 1 in 1 to 2,000. When comparing this to other forms of permanent surgical sterilization, it's 10 times more effective than tubal ligation. In discussing potential risk, there's a very small risk of bleeding and infection after. We may go to great lengths to ensure this occurs rarely. Rarely do men experience pain after vasectomy. Couples may ask, how will this affect sexual function after? Vasectomy has shown to improve sexual relationships because it alleviates the concern and risk for pregnancy after. Otherwise, sexual performance should not be affected. What are some of the alternatives to vasectomy? Most couples have already explored these options and have determined what happens when birth control is not used. As was stated, we specialized in the no-scalpel technique. First of all, we use numbing medicine to numb up the skin in the tubes. There is a vas on both sides of the scrotum, so we make 2 separate areas where we numb up the skin and tubes. We use a very special vasectomy instrument to make a very small skin defect in the incision. The vas is then brought up out of the incision. We do 4 things. We first cut out a segment. The 2 cut ends are clipped and cauterized. We then sew the up end in a separate tissue planes to make sure the tubes do not recanalize. We meticulously inspect the wound to ensure there's no bleeding afterwards. The skin is then closed with a single dissolvable stitch. We send patients home with 4 things. First, everybody was giving my card and cell phone. If there are any questions or concerns, we recommend no hesitation to call. We give an instruction packet and a small prescription of pain medicines. Usually ibuprofen and Tylenol is adequate for pain control after the procedure. We do encourage some secondary form of birth control for the first 10 weeks. After the 10-week specimen is given, that's no longer necessary and the vasectomy is fully effective. As for the recovery, men need to lay on the couch for 48 hours after. They use the bag of ice and peas to help reduce swelling and bleeding after. You're encouraged to wear the compression shorts for 48 hours. If the procedure is done on a Friday, most men return to work with no reactivity restrictions on a Monday. We do encourage no heavy lifting or no vigorous exercise for 5 days after the procedure. In conclusion, we have discussed what to expect for a vasectomy. We have talked about what to anticipate in planning for a vasectomy, what occurs on the day of the procedure, and the recovery. Feel free to visit our website at vasectomyutah.com. Feel free to call our office at 801-475-3160 to schedule an appointment, or if you have any questions, we'd be happy to answer them. Thank you.